When you think of indigestion, you probably think of a burning discomfort or pain in your upper tummy. The reality is that this is one of the symptoms of indigestion, also known as dyspepsia, which includes bloating, belching, feeling sick, and being sick. All these symptoms originate in the upper part of our digestive tract, which includes the food pipe, known as the esophagus, the stomach, and the first part of our small intestine, called the duodenum. So what causes indigestion? Inflammation. Our tummy and duodenum can become swollen due to certain types of foods, smoking, or alcohol. This is common. It can get better by itself if it's mild, but it can also get worse and cause ulcers. Our tummy and duodenum has a protective layer lining it. When this protective layer is damaged, the underlying tissue is exposed, and this can be painful. Helicobacter pylori is one of the commonest infections in the UK, with almost 25% of people infected. The worst thing is we don't know much about how and why people get infected, and most people with H. pylori have no symptoms and don't even know they have it. It doesn't bother most people, but it commonly causes indigestion. Acid reflux is another cause. Our stomach produces strong acid to help break down food before we absorb it. Sometimes acid from the stomach leaks up or refluxes from the stomach into the food pipe. The stomach and duodenum is made to withstand the strong acid in our stomach, but the food pipe isn't. When this happens, it burns. Babies get this a lot too, which can cause discomfort and posseting. Hiatus hernia is another cause of indigestion. This is when part of the tummy moves up into our chest. This causes pressure and acid to push up towards the food pipe. Some medicines cause indigestion, with common culprits being ibuprofen and aspirin, among others. Loads of other medications also cause indigestion, including antibiotics, steroids, iron. If you take medications and have indigestion, it's definitely worth checking the side effects, as there's a chance this could be triggering it. Often for people that have indigestion, there's no obvious cause. This is the commonest type, which means we don't exactly know why you have it, but you don't have anything worrying, and it's usually due to the food, mood, and drugs or alcohol. Lastly, these types of symptoms can also be caused by food pipe and stomach cancers, often in the context of other worrying symptoms though. In clinic, inflammation and reflux are the commonest causes, with most people experiencing indigestion in bouts, usually caused by specific triggers. A lot of people with indigestion symptoms self-manage with over-the-counter antacids and over-the-counter medications. This is fine, but if symptoms persist for more than a few weeks, or you become reliant on the medications to function, you need to get it checked out. If I see you in clinic, I'm particularly interested in when you got your symptoms, how bad are they, and how long have they lasted for. Your diet. Food is an important trigger here, especially coffee, chocolate, tomato, spicy or fatty food. And it's not just what you eat, but when you eat. For example, missing meals, large meals, or eating just before going to bed can also trigger indigestion. Do you drink or smoke? These are really common stomach irritants, and things often improve once you restrict or stop these. Can you taste any acid in your mouth? This is strongly linked with reflux. And is there any family history of stomach or food pipe cancer? Medications, just as I mentioned before, are you on any? Could they be causing your indigestion? Also, drug allergies are important, as the treatment for H. pylori is antibiotics, so we need to make sure you don't have any allergy to these. And finally, red flags. These are symptoms or signs that may indicate serious disease, like cancer. We mentioned that cancer can cause indigestion symptoms, and if this is the cause, it will usually be associated with other symptoms, such as unintentional weight loss, loss of appetite, acid reflux, abdominal pain, difficulty swallowing, and feeling really run down. If you have these symptoms in the context of indigestion and it doesn't go away, especially if you're over 55, then you need to get checked out quickly. The history is often really helpful in narrowing down the specific cause. It's also useful to perform a physical examination to exclude the worrying causes of indigestion. Often the examination is completely normal, apart from the very mild discomfort when pushing on the upper part of the the tummy where it's inflamed. This is common. We don't often perform any blood tests if there are no worrying symptoms, but we do usually arrange a poo test to check for H. pylori, that really common infection that causes indigestion and ulceration. This is quite a satisfying diagnosis as it's easy to treat and often fully resolves the problem and the symptoms. If there are symptoms that may indicate cancer, or if the cause of your symptoms are unclear, then we will often refer you for a camera test of your stomach and duodenum called a gastroscope, which is a small camera that passes through the throat down into the stomach. This is a really useful investigation that allows us to directly look for signs of irritation, inflammation, ulceration, or even a hernia, as well as to take samples of any abnormal tissue to check for growths or infection. Check the description below to learn more about these camera tests. So how do we manage it? Most people find out through trial and error what works for their indigestion. This can be avoiding certain triggers or taking certain medications. This is fine in the short term, but if you find yourself stocking up on these medications with your weekly shop, then you need to get it checked out. Lifestyle tweaks are key here. Avoiding trigger foods and eating smaller meals 3 to 4 hours before going to bed, stopping smoking and restricting alcohol are all very effective, and for many people, does the trick. On top of this, managing stress is really important too and can prevent a short flare-up from becoming a long-term one. If you're found to have H. pylori, then we can treat this with antibiotics and a tablet to decrease the acid in your stomach to allow the lining to heal. Most of the time, this categorically treats the cause and symptoms, but sometimes, like all bacteria, they can be resistant to certain antibiotics. So the symptoms persist and you may need another course of treatment with a different lot of antibiotics. We may need to tweak your medications too, especially if you're taking things that can trigger indigestion. Anti-inflammatories are a major issue here. If you've had ulcers in the past, you may need to take an additional drug to protect your tummy if you really must take them. The lifestyle issues are really important to prevent more of the same in the future, but for immediate relief and to settle an inflamed, ulcerated or refluxing stomach, we can often prescribe drugs to lower the acid in the stomach. These are drugs like omeprazole or lansoprazole and ranitidine. We recommend that you take them for a month usually when we prescribe them. The month treatment course gives you time to institute lifestyle changes and also to see, once you stop the medication, if the symptoms fully go. They almost always do, and people will often notice benefits in their symptoms within hours of taking the drug. You can buy these drugs too over the counter, and they're a staple of many people's medicine cabinets. If after a month symptoms persist despite lifestyle changes and a medication course, then you need to return to speak to your healthcare professional for a review and a consideration of alternative management and what the cause is. Some people do require long therapy with drugs for their symptoms, and this is fine too, but you should be evaluated annually if this is the case, and it's more than likely that you should have had a camera test of your stomach to have clarity on the exact cause of your symptoms. If your indigestion continues or your infection just doesn't go away with at least 2 courses of different antibiotic therapies, we often consider a referral to a gastroenterologist or a stomach doctor for a further review. If you have worrying symptoms, as mentioned above, we would arrange this review immediately with a plan for a camera test within weeks. Indigestion is really common and there are a number of causes. The commonest causes are due to lifestyle factors like food, caffeine, smoking, and stomach infections. Many times, indigestion can be managed at home with lifestyle and over-the-counter treatment. If it persists though, or you have other worrying symptoms such as weight loss, difficulty swallowing, and reflux, then you should always get this checked out. We have a very low threshold for arranging a camera test in these situations. Many thanks for watching. Till next time, stay healthy.